Good afternoon. The subcommittee will come to order. I want to thank everyone for being here today to discuss veterans' homelessness, which is a very high priority for myself and for the ranking member. We're going to evaluate some topics of homelessness among our nation's veterans. As always, I appreciate the nonpartisan approach the subcommittee takes when working on this issue. Since 2010, homelessness among veterans has decreased by 52%, and that should be noted. Much of this reduction in homelessness is the result of the hard work of this committee, community providers, local officials, and the VA. However, I'm concerned about the continued government spending on homeless veterans programs and the fact that in 2023 point-in-time count, despite the increased funding, the number of veterans experiencing homelessness actually increased. So why is it that we're spending over $3.1 billion at the VA to address homelessness among our veterans this year, which shakes out to be about $90,000 per veteran, but the number of veterans is increasing? And I want to bring a very salient point here. The average E7 after serving 20 years in the military retires with an honorable discharge will receive a pension of $34,810 a year. So we're spending nearly 3 times as much for a single homeless veteran as an E7 honorably discharged after 20 years is receiving. So we are doing something wrong. We just are. And nobody, Democrat or Republican, on the subcommittee wants to see a single homeless veteran. I want to be very clear with that. But we have to be able to shape these policies so that we can be more effective, and I think that that's going to take place when we look at more upstream solutions. I hope to receive answers on the increase and what can be done to address this worrisome trend immediately, and I also hope to hear from stakeholders in the VA about how we can be more flexible with the funding we have now, not just the funding in the future. We've heard from numerous providers about the need for more flexibility and how the funds in Congress appropriated can be spent. We have also heard the need for a better and more coordinated data collection by the VA so Congress and providers have a better picture of the state of veterans' homelessness nationwide and in their own communities. And I'm honest to goodness, I'm sick and tired of hearing that it takes Congress years to act. I'm just done. A veteran on the streets needs to sleep peacefully every night, and they have to eat every day, and they shouldn't have to wait for us to get our act together collectively. The subcommittee needs a better picture from the VA about the actual issues veterans and providers are dealing with so that we can be proactive. Whether it's a lack of mental health treatment, ineligibility for economic opportunity programs, or whether it may be, or whatever it may be, we've got to focus on the root cause of homelessness. Doing this will keep veterans off the streets, save the taxpayer money, and most importantly, save lives. The suicide rates among veterans with indications of homelessness is 186.5% higher than the suicide rate for veterans without a home, literally life and death. Something clearly is not being done right at the VA, and this is too important of an issue for us to ignore. Additionally, if Congress had more up-to-date information and providers could be more flexible with the resources they already had, we wouldn't have to develop more legislation to try to fix the problem. VA does, in my opinion, have the tools that they need. There are a number of providers across the country that have developed creative ways to lift veterans out of homelessness. Some communities have developed one-stop shops to try to address the underlying needs of the veterans who seek help. Others have developed by-name lists to allow the providers within the community to coordinate the services provided to the veterans and ensure no one is falling through the cracks. Some communities in my state address homelessness through faith-based organizations that are not taxpayer funded. I'm very pleased to welcome my constituent, Randy Withrow from Lutheran Social Services of Wisconsin, as a witness today. Did you bring cheese? Okay, because we're running short here. Lutheran Social Services provides housing and services to veterans in 3 locations in Wisconsin, including Chippewa Falls, which is in my district. I look forward to you all hearing Randy's testimony and the story of hope and the good Lutheran Social Services and the good that Lutheran Social Services has been doing for our community. Other communities such as Miami have developed a creative way to raise funds to supplement the taxpayers' dollars they receive. These alternative methods of funding provide additional flexibility to our providers. I look forward to hearing from the VA and the second panel about what steps Congress should take to make sure the data on homeless veterans is more up to date. Communities are collaborating to address underlying causes of homelessness among veterans and how VA can more effectively use funding rather than continuing to balloon their budget. And with that, I now yield to my friend Ranking Member Levin for his opening remarks.
Thank the chairman for his nonpartisan focus on veteran homelessness today. And I've had the honor of serving for 5 years, and the issue of veteran homelessness and ending it in my region and really throughout the United States has been top of mind for me for as long as I've had the honor of serving. It will be for as long as I serve. And we've made good progress, as the chairman said, but we have such a long way to go. And getting into the community and understanding what our homeless veterans are going through, what service providers are going through, that's been really top of mind for me and will continue to be. I want to talk about data. I know it's not the most exciting thing for everybody, but I think it's really important that we cut to the chase and we get the numbers, and that we're all, at least as we consider the right public policy, we're playing from the same data set, understanding the same data. We have witnesses from all over the country, from areas both urban and rural, who'll talk about how their communities and programs are moving the needle to get every veteran into stable housing. That's really what this is all about. Those efforts look different in different parts of the country, but one thing underlies and unifies a successful homeless response, and it's data, I believe. So I hope this hearing will maybe clear some things up about veteran homelessness, including the reality of the state of housing insecurity in this country. Each January, continuums of care across the nation participate in a point-in-time, or PIT count, to estimate how many sheltered and unsheltered people are residing in their catchment area. During these annual surveys, continuums of care try to identify those veterans experiencing homelessness. But due to the changing methodologies and which definition of veteran each continuum chooses to use, results can vary from year to year, making PIT counts an imperfect, I'm being kind with the word imperfect, picture of the reality of veteran housing insecurity. Last year, the PIT count identified nearly 36,000 veterans, a decline of 50% from the 2010 count, which identified over 76,000 veterans. Now, I in no way want to discount the work that went into that decrease and the value of those numbers, which illustrates the downward trend in veteran homelessness. They clearly show that the approaches that VA and HUD and USICH and communities are taking to reduce veteran homelessness are working, but they don't necessarily show how many veterans are being served within the system each year. As our witness organization, Community Solutions, frequently says, PIT counts are snapshots. Our communities need video. VA has that video. In stark contrast to that 36,000 PIT count number from January of 2023, VA's data shows that nearly 300,000 veterans engaged in its homeless programs during 2023. Whether these veterans are being served through grant and per diem, health care for homeless veterans, veterans justice outreach, supportive services for veteran families, HUD-VASH, or the many other programs VA operates within its community partners, it's clear that housing insecurity, at the end of the day, is much more prevalent among veterans than portrayed in the PIT count. I think it's important that we in Congress start using the larger number to more honestly portray the need of housing insecure veterans in our communities who are at risk of homelessness. Now, many of VA's programs prevent at-risk veterans from falling into literal homelessness, which helps drive that PIT count number down, but there are still so many veterans who require assistance. We've got to continue to adequately resource VA to serve these veterans when they need it most. So I have a prop. I was telling the chairman, it's my first prop, I think, that I've had in HVAC. But VA deserves our praise for making sure that 36,000, the 36,000 number over there, of homeless veterans in the PIT count does not rise to the 300,000 level of the number of veterans it serves through its homeless programs each year. And it's clear that VA is integral to keeping that number of literally homeless veterans down. VA has made impressive strides in refining its data management over the last few years. It's enabled VA to identify who the homeless veterans are in communities across the country. By knowing who each veteran experiencing homelessness is and where they are, VA and its providers can target outreach and interventions to get veterans on the path to stable, permanent housing, and they can do it quickly. So this will allow VA to track returns to homelessness and the unfortunate circumstances when a veteran who was previously housed loses that housing. By identifying those veterans, VA can intervene with the resources to ensure the veteran's housing stability. And part of VA's mission for its homeless programs is to ensure that homelessness for veterans is brief, rare, and non-recurring. Data is clearly integral to VA fulfilling that mission. So I'm so grateful, Mr. Chairman, for this conversation we're going to have today with our witnesses. I thank them for being here to discuss the good work happening nationwide to end veteran homelessness. And I yield back.
Thank you, Mr. Levin. I'll now introduce the witness panel. Our first witness is Dr. Thomas O'Toole, Deputy Undersecretary for Health and Clinical Services at the Veterans Health Administration. And our second witness is Mr. Jeff Olivet, Executive Director of the U.S. Interagency Council on Homelessness. I'll ask the gentleman to stand, please, and raise your right hand. Will you raise your hand? Thank you. Do you solemnly swear that the testimony you're about to provide is the truth, the whole truth, and nothing but the truth? Let the record reflect that the witnesses responded in the affirmative. Please be seated. And Dr. O'Toole, you haven't been here before? Yep. So you know the deal. 5 minutes is 5 minutes. Good to go? The old senior chief will come out. Dr. O'Toole, you are now recognized for 5 minutes to deliver your testimony.
Good afternoon, Chairman Van Orden, Ranking Member Levin, and committee members. My name is Thomas O'Toole, Deputy Assistant Undersecretary for Clinical Services with the Veterans Health Administration. Thank you for the invitation to testify before you today. For the past 30 years, I've been caring for homeless veterans. In the last 18 years at VA. I'm incredibly proud to be part of our mission to end veteran homelessness. They have earned and deserve all the care, support, and services we can provide. Over the past 13 years, we've seen a substantial decrease in veteran homelessness. As noted, a 52% drop in the point-in-time count compared to 2010. During that time, VA placed over 1 million veterans and their families in housing or prevented them from becoming unhoused. Most recently, Dallas, Texas reached a remarkable milestone, joining 83 communities in 3 states in achieving functional zero. Dallas now has the systems, resources, and capacity in place to quickly identify and house any veteran experiencing homelessness. All of this has occurred despite high unemployment rates following the Great Recession, disruptions from the COVID pandemic, and now with unprecedented housing shortages in many communities. There are many reasons why. We have benefited from consistently committed leadership and support from Congress and within VA toward our goal of ending veteran homelessness. The professionalism and dedication of our care teams has been critical, and we also must acknowledge the leadership of the U.S. Interagency Council on Homelessness, our partnership with other federal agencies, collaboration with our nation's governors and mayors, work with groups, including many on your second panel, as well as community organizations. Most importantly, when a veteran experiencing homelessness is identified, they are not just screened and referred somewhere else. They get the full force of VA support. We are able to quickly provide integrated housing and social services, ready access to mental health and substance abuse treatment, primary and specialty care. We have data systems to measure our progress and map services to needs and capacity to fast-track research innovations. This is at a scale unmatched. Last year alone, VA served well over 200,000 veterans. We have ambitious goals for 2024, placing at least 41,000 currently homeless veterans into permanent housing, ensuring that at least 95% stay housed, and engaging with at least 40,000 unsheltered veterans to provide housing and wraparound services. Targets that we are on pace to meet and exceed. To date, over 31,000 veterans have been permanently housed this year. We have a 97.8% retention rate and have engaged more than 28,000 unsheltered veterans. These goals are floors, not ceilings, and we will push ourselves as long as there are veterans in need. All this means nothing if it does not translate to real impacts for our veterans. I'm reminded of a friend and former patient, Steve Iadaluca, whom I first met about 10 years ago at our Homeless Patient Aligned Care Team clinic. An Air Force veteran in his mid-50s, Steve had been installing HVAC units until an injury caused him to be laid off. No paycheck quickly led to an eviction, and unwilling to burden his family, Steve found himself homeless. Our outreach team quickly got him a bed in our grant per diem program, Gateway to Independence, run by the YWCA of Providence. Once there, we got him VA health care to address and stabilize long-deferred needs. He then received a HUD-VASH voucher, giving him permanence and stability while working with our employment specialists to re-enter the workforce. Steve now works full-time at the Providence VA Medical Center in our employee education department. He is helping others. He's graduated from the program so the next veteran need can be helped. Being able to share Steve's successes make them successes for all of us. Chairman Van Orden, Ranking Member 11, every veteran should have access to permanent housing with the supports needed to affirm their dignity and allow them to achieve their potential. Thank you for the opportunity to update you on VA efforts. Although we have made significant progress, the job is not done, and our continued partnership is essential. I look forward to continuing to work with you and your staff, and I'm prepared to answer any questions you may have.
Thank you, Dr. O'Toole. The written statement of Dr. O'Toole will be entered into the record. Mr. Olivet, you are now recognized for 5 minutes to deliver your testimony on behalf of the U.S. Interagency Council on Homelessness.
Thank you, Chairman Van Orden and Ranking Member Levin. I'm Jeff Olivet, Executive Director of the United States Interagency Council on Homelessness. It's an honor to appear before you today. I'm here to discuss the nation's homelessness crisis and the administration's current and planned work to address it. As the sole federal agency dedicated to eradicating homelessness, USICH holds a unique position. Our agency leverages the collective strength of 19 other federal agencies to orchestrate a coordinated federal response to homelessness. Our member agencies oversee more than 30 programs aimed at homelessness and numerous others supporting individuals grappling with poverty and housing instability. Our team of senior regional advisors, strategically positioned around the country, supports mayors, governors, and local service providers to ensure the efficient, effective, and compassionate use of resources. The story of USICH is a testament to the power of nonpartisan collaboration. In 1987, large majorities of Congress, transcending political lines, passed the Stuart B. McKinney Act, later renamed the McKinney-Vento Homeless Assistance Act. This law, signed by President Reagan, recognized the complexity of coordinating federal efforts to address homelessness. It was a clear message that homelessness is a cross-system problem that requires cross-system solutions. No single agency, system, or sector can end homelessness alone. Even just one veteran experiencing homelessness is a tragedy. It is unacceptable that anyone who has served this country leaves military service only to experience the trauma of homelessness. According to the Department of Housing and Urban Development's 2023 point-in-time count, as you said, Chairman, almost 36,000 veterans were experiencing homelessness in a snapshot at the beginning of 2023. That's 22 out of every 10,000 veterans. More troubling, the number of veterans experiencing homelessness increased by 7% between 2022 and 2023, including increases in both unsheltered and sheltered homelessness. Despite these increases, we know that over the past decade, homelessness among veterans has been slashed by 52%, and we should both celebrate that success and challenge ourselves to finish the work. Ending veteran homelessness means that homelessness among veterans is prevented upstream whenever possible, and that when it does happen, it is rare, brief, and one time. In the work to end veteran homelessness, I would also like to hold up the work of Dallas because it's fresh on our minds, as you heard from Dr. O'Toole. Dallas just joined 83 other communities around the United States in declaring a functional end to veteran homelessness. And that work has been done through very close collaboration between the VA, local partners, and with the resources of HUD-VASH, SSVF, and other critical programs. This collaboration is no accident. It is the result of everybody rowing in the same direction, and we want to build on that success and replicate it in other communities. The Biden-Harris administration has taken sweeping new steps that are beginning to yield results on homelessness more broadly. Through the implementation of the White House Housing Supply Action Plan, more units are under construction than ever before. In 2023, HUD announced that it had helped more than 424,000 households avoid homelessness, exit homelessness, and connect with the housing and services they need. And in January, the VA announced that it had housed more than 46,000 homeless veterans last year, surpassing its goal for 2023. I believe that it is possible to solve veteran homelessness. I don't believe it has to be this way. And we all have a role to play in that. We do within the administration, our partners on Capitol Hill do, and you all, I just want to commend the amazing work that you've done and the bipartisan nature of your work. I think it's an extraordinary example to the rest of us. This also requires local collaboration and deep partnerships with nonprofit providers, with some of the national and local organizations you'll hear from in the next panel, and with local leaders to finish the work of ending veteran homelessness. I thank you for the opportunity to be with you today and look forward to your questions.
The written statement of Mr. Olivet will be entered into the record now. I now recognize Ranking Member Levin for 5 minutes.
Well, thank you, Mr. Chairman. Thank you both for the work that you do as well. Thank you for your kind words, Mr. Olivet. Hopefully we'll never do anything on this committee to disappoint you or dissuade you of your opinion. Dr. O'Toole, I wanted to bring up the budget for VA homeless programs, which is a sizable one. It's $3.2 billion. What I want to do is give you the floor for just a second to explain how VA's data backs up that budget and what assurance you can provide us that that $3.2 billion is being put to its best and highest use.
Thank you, Congressman Levin, and I appreciate the question being raised. It is a very generous budget. We are very appreciative of Congress's support for us over these years through this initiative and for the oversight and holding us accountable. These are taxpayer dollars. We need to be good stewards of them. I think it is extremely important, and I want to provide some clarification, particularly to your chart, and I think to provide some backstops to some of the points and considerations it raises. VA serves significantly more veterans than the 36,000. Our job is to prevent individuals from becoming unhoused and homeless. Our job is to quickly rehouse them when they do. Our job is to move them into permanent housing, and our job is to keep them in that housing, which includes providing the necessary supports, the necessary care, and the necessary services that they need so that they can stay permanently housed and really return to their lives and livelihoods and potentials they have before them. As you know, the 36,000 veterans identified in the PIT count reflects really an incident count. It's a snapshot view, as you've noted, of how many veterans are identified on a given night in January, either in our emergency shelter system or in a street count. I'm not going to try to defend or deflect challenges and limitations to the counting process. It's something that has evolved, and there are always efforts to improve upon that. But what I will say is that it does not measure how many people are going to be homeless the next day, the next week, or the next month. And data from the Continuum of Care HMIS system has consistently shown that the actual number of homeless over a year's time tends to run 4 to 5 times higher than that PIT count from that given night. So that it unfortunately misrepresents the full scope and need of homelessness that we're seeing across all of our communities. The issue, though, that I think is extremely important in addressing the question that you raise is that the $3.2 billion represents a segue into a large scope of services within the VA. And these are resources that are leveraged to provide the needed health care, mental health care, job employment services, veteran benefit services for veterans. It's an all-in effort by VA, and it shouldn't be viewed as something that is isolated to only the Homeless Program Office, to only those $3.2 billion, but a much rather scope and a much rather investment in these men and women who have served our country, who need to get a hand up to be able to get back on their feet.
Thank you, Dr. O'Toole. With time I have left, I want to ask about the VA by name list. In my opening statement, I mentioned the importance of knowing who each veteran experiencing homelessness is and where they are. Without comprehensive by name data of every veteran experiencing homelessness across the country, we'll never be able to properly target outreach or interventions to get veterans on the path to stable permanent housing. So, Dr. O'Toole, how close is VA to having a national by name list that shows each veteran experiencing homelessness? And please use actual time frame, months, weeks.
So the by name list is a game changer for us. And let me be very clear. it is essential from going from aggregated data to actionable data to be able to have that by name list. We have in place right now a by name national list of veterans who have experienced homelessness who are part of the VA system. What we are working on currently, however, is making sure
He's
that
got his gavel. Give me the time. How long?
we are beta testing the capacities to be able to interface with the community
Months,
continuum
weeks?
of care by the end of this calendar year. We will be
End of the
beta
calendar
testing
year.
it.
Thank you. Yield back. Thank you.
Yeah, that's good. Don't try to filibuster that cat. The chair now recognizes my great friend from the state of Arizona, Mr. Crane.
Thank you, Mr. Chairman. Thank you, gentlemen, for showing up today. So I was looking at Mr. Levin's chart there, and sir, were you saying that on average, on any given night, that number could be around 150,000 veterans that are homeless? Is that what you were saying?
No, sir. On any given night, there may be 36,000,
Okay.
which is what was consistent, but it's not going to be the same 36,000. And so it is
I thought you said it was 5x that number.
right, over a period of, so the incident count is a snapshot that looks at homelessness on that given night. The individuals who are homeless may change. And there is an influx into homelessness and efflux out of homelessness into doubled up arrangements. So collectively, if you look at all of the individuals who experienced homelessness over that 12-month period, it's going to be 4 or 5 times higher than the 36,000 counted on that one night.
What kind of trends are you guys seeing when you look at this demographic? Are you seeing regional trends? Are you seeing service-specific trends? Can you enlighten us on any trends that you guys are seeing?
Well, clearly our challenge points are in communities that have some of the most difficult and tightest housing markets. You know, as we all know, different parts of the country have seen the stock of affordable housing dry up, and it becomes extremely difficult. And we're seeing increases in the homeless communities in those settings very much. We have subpopulations of homeless that we are tracking and working diligently to try to address. There is an aging homeless population that poses significant challenges and issues. We've seen an increase in women veterans who become homeless, in part because of the number of women veterans that have increased as well. But this is a significant and concerning issue, particularly those who are unsheltered and a few others.
Mr. O'Toole, has the VA done a study to illuminate the major causes of veteran homelessness?
I mean, it's the VA and academic affiliate organizations around the country and world have been looking at how to end veteran homelessness.
Is there a study that you guys cite and use?
We know that housing is the solution for homelessness. We know also that it needs to be housing with supports. And that is the strategy that we follow. I think the blueprint that USICH has developed.
Sir, that's not what I asked you.
Okay, please.
I've asked you twice now. Is there a study that you guys have done to look at the causes of veteran homelessness, like drug abuse, living under the poverty line, not having affordable housing in your region? Is there a study that you guys use and can cite or provide to this committee?
Thank you, Congressman. We can take that as a due out. There are a lot of studies that we use and reference, and I'm happy to provide that to the committee.
Okay, so in the please do that, sir. In the $3.2 billion that you were talking about, I think you mentioned healthcare, mental health, job employment are 3 of the big focuses. Was there anything else in that?
Yes, sir. There are prevention and our prevention services through the SSVF program, Supportive Services for Veterans and Families, is a huge issue and has a significant impact for our veterans. Providing permanent supportive housing and the case management support for those veterans, providing outreach through our outreach team stand downs, providing transitional and just-in-time housing would be the other bucket that I would want to emphasize beyond that.
Do you guys see a segment, sir, even if it's a small segment of veterans, that even if you were to provide them programs to help them find a job, even provide them housing, that just don't want to live traditionally and just want to, be out on their own? Is there even a cross-section of veterans that you find that are in that boat?
Congressman, I've been working in this space for a long time, providing direct care to veterans. Yes, there definitely are some. I couldn't give you a quote you a specific number, but I would also tell you that, motivation changes. Situations can impact motivation. And somebody who may say that they don't want to move out of an encampment this week, they may change their mind the following week. And our job is to continue to be there and be available and be with them and encourage them to make those changes.
Mr. Chairman, can I have one more question?
Please do, Mr. Crane.
What about addiction, Mr. O'Toole? You see any correlation with veteran homelessness and addiction?
Yeah, absolutely. Substance use disorders, addictions clearly correlate. It's not necessarily the majority of homeless by any stretch, and I think that's an important emphasis point, as with mental health. But we see roughly 40%, 30 to 40% of individuals with active addictions when they come in, and providing for them the treatment that they need is critical to their pathway to sustainable permanent housing.
Thank you, Mr. O'Toole. Mr. Chairman, I yield back.
Thank you, Mr. Crane. So what I got from this little discussion that you guys just had is that the VA is using multiple different studies to try to determine what the causes of homelessness are. And I want to, Mr. Crane, I'd like to get with your staff when we're done here, and potentially Mr. Levin, and we'll do it first. That is a wholly unacceptable answer, man. So which study do you trust? Who did the study? Do they have equities involved? So if we can't figure out why they're homeless, how in the hell are we going to help them not get there to begin with? So, Mr. Crane, if you're okay with that, I think we've had experiences with the VA before, Mr. O'Toole, not you in particular, but we've learned in the 7 minutes that Eli and I have been in Congress that if we don't tell you to do something, it's not going to happen. So let's figure out, Mr. Crane, something to figure out a way to direct that, because we need to have that data, and that dovetails perfectly with what the ranking member was saying about having actual, real data. Is that right, sir? Mm-hmm. Okay, so we're good. All right, I now recognize myself for 5 minutes. Mr. O'Toole, you have a budget of $3.2 billion. How many employees do you have?
There are 6,800 employees that work within the Homeless Program Office, providing services
Roger that.
into the
I
community.
got it. I was just asking for a number. What's the average pay grade?
I do not know that off the top of my head, sir. We'll have to do a due out.
Have you increased your numbers of employees since 2022?
Yes, we have, sir.
By what factor?
We are I do not know by what factor. We strive for a 90% employment rate, and we are currently in the high 80s in terms of filling our vacancies.
Let's say you had 100 employees in 2022. Now you have like 110 or okay. So we're spending $3.2 billion, $90,000 per homeless veteran. You've increased your manning, your administrative staff from 2022, and since then the veterans' homeless rate has increased. So that dog does not hunt. It's just not okay. We're spending money on administrative people, bureaucrats, and not on veterans. And we're not getting a return on investment. The return on the investment is not a monetary thing. It's a homeless veteran not killing themselves or becoming a drug and alcohol addict and committing a crime and then starting this downward spiral of permanent incarceration, which we need to end. When you approach this problem set, and that's exactly what this is, do you have a plan for a continuum for individual veterans, meaning veteran enters program, veteran exits program?
Yes, sir. Well, may I first clarify, the 6,800 employees are direct service care providers. These are not administrative positions. Secondly, yes, sir, one of the efforts...
So hold on a sec. So you've increased care providers, and you still, homeless veterans are increasing, so what's the difference?
Well, I'd like to, if I can, clarify or at least amend one of the observations there. Yes, the point-in-time count did increase, and we fully accept that and are working for it. It is not acceptable. the increase among veteran homelessness was actually much less than the increase in the general population. There are a lot of factors that go into that increase, and I fully acknowledge that, and that's another discussion, and happy to spend the time going
Okay,
into
so
those
do you have
factors.
a plan for each individual veteran, a continuum of care, veteran enters program, veteran exits program?
Yes, we do, sir. This is
And
part
what
of
does
the
exit mean to you?
exit for us can reflect one of two things: permanent supportive housing, or those supports are continuing to be needed, but
Meaning they're still involved in a program because
they are still involved in the program because they may have ongoing care needs, mental health, substance use, disability management, and so forth. Or
Mr. O'Toole, where I come from, that's not an exit, sir.
okay.
That's just a different involvement in a program. It just is. If they're still involved in a program and they're not living autonomously in dignity, then they're still involved in a program. They have not exited the program. Steve got a job at the VA. That's awesome. That's a government job. So what percentage of the veterans that we're helping, that you're helping with your 6,800 employees, go on to work in the civilian sector where they're actually not part of the government? Because we can wind up hiring the entire population. That's called communism. And I'm not implying that you're a communist or that Steve's a communist. I'm saying that when universal governmental employment is taking place, that's a different system of governance than we live under. So what percentage of your veterans that are participating in this program are getting jobs in the private sector?
That will have to be a due out for us to give you those specific numbers, but we do have about 10% of our population every year leaving the HUD-VASH program because their personal economics and their income prices them out.
That's awesome. And that's a good thing. Mr. Olivet, 84 communities have gotten to functional zero. That is an incredible accomplishment. What percentage of those communities, or excuse me, what is the difference between those 84 communities and other communities that are not at functional zero?
I think what we see as common across those communities is very, very close collaboration, where there are strong local nonprofits working with strong VA leadership at the local level and making very efficient use of the resources, both VA and private resources. We also see a real commitment to housing, getting people into housing as quickly as possible so they're not languishing.
Mr. Olivet, my time has expired. I just asked the ranking member to school that I'm going to yield myself an additional 2 minutes. Please continue with your answer.
Thank you. The commitment to housing is fundamental. So when we see communities emphasize housing, I was in Dallas last month and met with a number of leaders, met with a number of people who are in these programs.
Mr. Olivet, you're saying that the 84 communities that have reached functional zero have a higher level of coordination in between these different agencies than other communities?
I certainly think that's one of the ingredients, yes.
Okay. What percentage of these organizations that are communicating with each other better than the rest of the nation are faith-based?
It would be hard to quantify that number, but what we do see is that the faith-based community has a very strong role to play in this work.
So do you actually have a list of these different entities within the 84 communities that are coordinating better to each other that have reached functional zero?
A list of the local agencies working on it? I'm not sure that we have a comprehensive list for every community.
Okay. If you find a winning team, you look at the composition of the winning team, sir. So what I want from you is a list of the different groups in these 84 individual communities that have reached functional zero so that we could take that as a basic model and apply it to the other communities that have not reached functional zero. Because it just seems like we're shooting in the dark here. And when Mr. Levin says he wants data, that's real data. So we want to get to functional zero. 84 communities have. The other thousands of communities haven't, including Camp Pendleton, San Diego. Mr. Levin, he's got a beautiful district. He represents Camp Pendleton, home of the Marine Corps. I mean, they're bad. I mean, good dudes, right? They are. I love them. No one will besmirch the glorious Corps in my presence. So let's see if we can get the models from these 84 communities to his district. So I want that from you, sir, and let's look at this collectively. Now, with that, my time is expiring. I thank you very much. We're good? Okay. The witnesses are excused. I hope you'll stick around for the second panel. On our second panel, we'll hear from the following witnesses. Ms. Haggerty, President of Community Solutions, Mr. Carville, Public Affairs Manager of Veterans, Inc., and Mr. Wood, Regional Site Director at Nation's Finest. I'd now like to welcome the witnesses on our panel and ask them to stand and raise. Oh. Dr. Whitrow, are you here too? Yes, you are. And Dr. Whitrow, yes, my one constituent. I'm sorry about that, sir. Please raise your right hand. Do you solemnly swear to tell that your testimony you are about to provide is the truth, the whole truth, and nothing but the truth? You may be seated. Let the record reflect that all witnesses have answered in the affirmative. Ms. Haggerty, you are now recognized for 5 minutes to deliver your testimony on behalf of Community Solutions.
Members, thank you for the opportunity to appear before you today to share how communities in suburban, urban, and rural areas are reducing veteran homelessness through a data-driven, collaborative approach. My name is Roseanne Haggerty. I am the President and CEO of Community Solutions. And first, I'd like to acknowledge the progress of our federal partners at the VA, U.S. Interagency Council on Homelessness, and HUD, and the progress they have made in reducing veteran homelessness. I especially want to recognize the adoption of the One Team approach, which involves coordinated actions and program interventions aimed at ending veteran homelessness and providing homeless veterans with a holistic housing and tailored services plan. Now, Community Solutions is a national nonprofit working toward a lasting end to homelessness. We support a network of more than 140 U.S. communities across 38 states. Our aim is to reach a tipping point where homelessness is understood as solvable, progress is expected, and a critical mass of communities are achieving measurable reductions by the end of 2026. Now, working with communities through an initiative called Built for Zero, we use a rigorous data-driven methodology to help communities change how local homeless response systems work and the impact they achieve. The key to this methodology is the creation of a comprehensive, by-name, real-time list of each person experiencing homelessness in that community. Real-time, by-name data has proven to be a game changer for every type of community working to end veteran homelessness. The use of real-time information allows teams to diagnose individual and system challenges, to problem solve, coordinate services, track progress, and course correct as needed, and gives local system leaders and policymakers the actionable information they need to know what's working and where things are stuck. It also enables teams to test ideas, innovate, and apply proven practices like continuous quality improvement to achieve measurable results. Now, currently, over 80 communities within our Built for Zero network are focused on reducing veteran homelessness. And of these, 45 communities have seen measurable reductions, and among those, 12 communities have made veteran homelessness rare and brief, the functional zero standard. And I'll say proudly that over 105,000 veterans in these communities have been housed since 2015. And now what this looks like on the ground is, for example, in Chattanooga and Central Tennessee, a multi-sector team can quickly rehouse any veteran who becomes homeless. Gulf Coast, Mississippi can rehouse any veteran who becomes homeless within 11 days. Detroit, Michigan has reduced veteran homelessness by 50%, leveraging data to coordinate services and expedite housing placements. Similarly, Metro Denver has reduced veteran homelessness by 30%, and the Twin Cities have reduced veteran homelessness by 24%. And also in Charlotte, North Carolina, we see the community team is working to make de-identified data available to the public to galvanize local support for ending veteran homelessness. These examples illustrate the power of quality real-time data to drive measurable reductions in veteran homelessness across diverse communities. Now, our vision is that every community in the United States, regardless of size or resources, can leverage data to its fullest potential to confidently identify and assist every person experiencing homelessness. And to harness the potential of quality data, we recommend several key policy changes. First, adopt the use of by-name data to drive reductions in veteran homelessness. Reconfigure systems, including the already strong Homes data system, to adopt a by-name data model. This approach allows for personalized tracking of each veteran, facilitates targeted coordination of services, such as through the One Team model being used by the VA, and accelerates their path to a stable home. Second, shift data standards to rely on regularly collected and reported real-time data. Once aggregated and de-identified, use this current data as the primary performance indicator for progress in addressing veteran homelessness. This provides a continuous and therefore more accurate picture of veteran homelessness and allows for timely and targeted interventions to ensure no veteran is left behind. And finally, enhance VA and community data sharing for homeless veterans. The federal government can enhance data sharing between the VA and community partners that are providing services for homeless veterans. Cleveland-Dole Section 309 mandates that the Secretary of Veterans Affairs and the Secretary of HUD collaboratively develop a system for effective data sharing and reporting between the community-wide homeless management information systems defined in McKinney-Vento and the VA's Homeless Operations Management and Evaluation System, HOMES. This system, which must be operationalized by the end of '25, aims to improve service coordination. Thank you very much for your time, and I look forward to answering any questions you may have.
Thank you, Ms. Haggerty. Ms. Haggerty's written statement will be entered into the hearing record. Mr. Carver, you are now recognized for 5 minutes to deliver your testimony on behalf of Veterans, Inc.
Good morning, Chairman Orden, Ranking Member Levin, and the distinguished members of this committee. Thank you for the opportunity to testify today. My name is Ray Carville. I'm the Public Affairs Manager of Veterans, Inc. We are the largest provider of supportive services for veterans and their families in New England. We are located in Massachusetts. We currently administer roughly 33 federal, state, and local grants. I'm also a service-connected veteran. I've served as an Army Human Intelligence Sergeant in Iraq and as a military contractor in Afghanistan. So today I'd like to discuss the critical importance of data, as we all are, and try and think of some convenient ways to visualize it. So I'd like to break it down into 3 sections. First, methodology and technology. How are we using the tools that we have already to facilitate greater efficiency in the people that are out there conducting the outreach, the people that are case managing the veterans once they are with us, and the grant managers that are reporting that information back up to their grantors. The second thing is policy, ways that this committee may be able to influence the ease with which we can provide these supports to veterans. And finally, a model that we may be able to use to more efficiently determine funding for our programs in disparate geographic areas of the United States that have different costs of living and different standards. So first and foremost, I'd like to say that when we talk about, I was pleased to learn that SSVF has the document management program in the works, which is essentially address my central point in the middle, which is that our case managers are completely overwhelmed with the lack of technological support that they currently have. The duplicative entries of data across multiple forms with no central repository in which to store them dramatically increases their workload. If it takes 45 to 60 minutes to enroll one of our veterans into one program, it takes that same additional amount of time to enroll them in another. If 75% of our veterans are enrolled in more than one program, our case managers are duplicating their efforts 75% of the time. Indeed, with that duplication comes even more problems. It comes with transcription errors, comes with incomplete data. We need a client resource management system that is intuitive, that is able to communicate a client from one silo to a provider in another silo. Somebody who is receiving homelessness assistance should never not receive training and employment just because there's no communication between those two silos. But first and foremost, we need to acquire these veterans. How do we get our outreach people in the ground with the tools that they need to find veterans today? We have to change our way that we think about veterans, right? We need to establish a whole new behavioral modeling of what post-9/11 veterans do. Because frankly, they don't do the same things that veterans from Korea and Vietnam and former eras do. We need a concerted effort to think about these folks as human beings, as individuals, where they tend to go, and behaviorally modify them in a way that I'm familiar with from doing my work as a human intelligence collector. You figure out where they're going to go, and you go to them to provide services. Now, I'd like to go back to your point, Representative Van Orden, about the composition of the winning team. A valuable tool for these outreach people on the ground to see what services are being provided and where the needs are graphic interface systems, a map system that you can overlay with multiple layers of data. If Dallas has a winning team, then I want to know where on that map of Dallas all those service providers are, what their outreach is, what representatives handle those areas, what city councilors, where the hot spots are for veteran homelessness, where the food pantries are, where the mental health centers are. I want to know who's covering down, and with that visual information, I can easily identify gaps, and if I model it through analysis, I can easily identify trends. Where are our homeless veterans going? Where were they 5 years ago? Where might they be in 10 years? These are the kinds of things we need to think about to get ahead of these issues. We can see things like the cost of housing going up in Massachusetts and veterans being pushed west. A graphical analysis tool for our outreach people that could be used handheld in the communities would be of an enormous importance. They can input the data from the veteran on the ground in almost real time and have the veteran there with them during the whole thing. Now, once we've acquired that data, it's getting it to that next level, that management and analysis level, where we want to run it through more robust programs than we're currently using. The military uses a wonderful network visualization tool called Palantir. I used it in Afghanistan. It's amazing for seeing what networks there are and laying that over the ground. But I'm running out of time, so I'm going to jump to policy, TAP. We need to take TAP out of the bases where soldiers are leaving, and we need to put TAP into the domiciliary states into which they are returning. This will give us an opportunity to ingest these returning veterans at the largest inflection point of their career when they return to their homes, to sit down and apply community-based organizations to triage them for their needs and ingest their data into our state veteran services repositories. We can know what veterans are at risk before they even step out of the TAP program. Finally, I would just like to add the DTS, Defense Travel Service, has established a method of funding zip codes all across the United States. Take one funding point, establish another funding point, you have a ratio of what it costs to provide services in that area. I'm sorry, I'm out of time.
The gentleman's time has expired. Did you go to Huachuca?
I did, sir.
You did, okay. Yeah, you're discussing something that's, the term of art is human terrain mapping, and we brought Palantir into the DoD initially for another purpose, and it's to find and remove people from the battle space. But if we could use that to find and remove people from homelessness, it's a great application for a program that was originally designed for something else, and I think that has merit, and it's also commercial off-the-shelf technologies. There's other ones. But I would like to, Kate, let's get together and talk about this. That's a very good idea. And with the VA, I know it's real hard to kind of get them to do stuff, especially when you're talking about advanced technologies and whatnot. But I do know that their heart's in the right place. I think we just have to show them how to aim that, and that's very compelling. I appreciate that very much. Mr. Carville's written testimony will be entered into the record. The chair now recognizes Mr. Withrow for 5 minutes.
Short arms. I'm Dr. Randy Withrow. I am the site director of the Veterans Housing and Recovery Program in Chippewa Falls. I've been hearing a lot of macro talk about the veterans. I'm here to offer the micro. Klein Hall is a 48-bed transitional program, GDP funded. Lutheran Social Services have been providing services in 3 spots across Wisconsin: Green Bay, Union Grove, and Chippewa Falls. And to start my discussion about the micro, I'd like to talk to you about Rocky. Rocky arrived to our residents feeling powerless over addictions to drugs and alcohol and without a place to live. With the help of LSS counselors and peer specialists, he found sobriety, secured VA disability, saved a substantial amount of money, and found independent housing. Going to your statement of when does the program end? Well, unfortunately, recovery is rarely a linear process. And so much in funding, we look at it as linear versus being more of the string approach. Rocky relapsed. And statistics are showing 85% are going to relapse. After several months, Rocky once again found himself dependent on drugs and alcohol, in significant debt, and staring at a 5-day housing eviction notice. He was in a dark place, contemplating suicide, and needed a safe place to be. Coming back into the program, he embraced his needs that programmatically we were able to provide. He attended all groups and meetings and counseling sessions. He connected with 12 Steps programs in the community. He became ServSafe certified through the program. Rocky graduated from the LSS Veterans Homeless Services in May. He is looking forward to independent living and committed in maintaining his sobriety. As somebody who has looked at statistics, as a therapist, it's important to identify what data points that we need to know. Adverse childhood experience, or ACEs, knowing what has happened in their lives, to be able to identify. People aren't homeless because they don't have shelter. People are homeless because of ancillary and secondary problems, mental health, substance abuse, self-doubt, PTSD, getting somebody to just simply file for their service-connected benefits will look at you and say, I don't deserve it. And to have to completely reframe their mental direction is a challenge. And it doesn't happen overnight, and it doesn't happen linearly. We want to look at what we call motivational interviewing, getting people to find where they are and where they need to be. Part of that is finding their strengths. The idea that they come in feeling helpless, worthless, and without, we talk about dignity, they're absent of dignity. And so the idea of retraining, and there isn't a manual of how do you get somebody to feel dignity. And that's what we struggle with every day. We have 3 case managers overseeing the 48-bed facility. We are non-medical, so we don't have any services that we can provide to even making sure they're taking their medications. We do have transitioned from a paper system to an electronic system, and with that, we will be able to collect more data on the individual so we can direct treatment. I appreciate the invitation and the time, and I hope that we can continue to work toward the goal.
Thank you, Mr. Withrow. Mr. Withrow's written testimony will be entered into the record. Chair now recognizes Mr. Wood for 5 minutes to deliver his testimony on behalf of Nation's Finest.
Thank you. Chairman Van Orden, Ranking Member Levin, members of the committee, thank you for the opportunity to offer testimony on behalf of Nation's Finest today. For 50 years, Nation's Finest's purpose has been to serve, house, and rehabilitate veterans experiencing homelessness. My name is Nicholas Wood, and I serve as the Regional Director for our operations in Arizona and Nevada. I am proud to have served the veterans in our communities for the last 10 years. Nation's Finest specializes in serving veterans in rural and remote areas. We did this for 2 reasons. First, there's a higher per capita rate of homelessness among veterans in rural areas, and second, there are fewer resources available to those veterans. One of the greatest challenges we face are inaccuracies with the PIT counts, which, as you know, determines funding sources federally. For example, in 2023, the Reno PIT count said that there were 152 homeless veterans in the area, but we've already served 282 veterans this year in our Reno office. Clearly the PIT count dramatically undercounted veteran homelessness in Washoe County. Reno's not an anomaly. We frequently see that official data does not reflect the actual number of veterans we serve. So, starting in 2022, Nation's Finest began development of our own tool called Veteran View. We did this to help get a more comprehensive count of potentially homeless veterans. Using this information, here's what we see in the Reno area. PIT counts have ranged between 119 and 152 homeless veterans over the last 5 years. But census data tells us that there are 1,598 below poverty disabled veterans, which are the veterans most likely to experience housing instability. Because the ratio between these 2 data points is high, we know that the PIT probably underestimates the number of veterans we actually serve. Chairman Van Orden, let's look at your district. The lack of major metropolitan areas means providers must use the PIT balance of state data, which is every town and county that is not in the major metropolitan areas of the state of Wisconsin. This is overly broad and another weakness of the PIT count. For your district, the Pitt says there are 176 homeless veterans outside of the major metropolitan areas. Census tells us that in Eau Claire and La Crosse, there are 363 below-poverty disabled veterans. I believe that that just goes to show that there is a disconnect between what providers are seeing on the ground and what the data is producing. Ranking Member Levin, for your district, we look at both the San Diego and Orange County numbers. Given the population size of these counties, it's difficult to say how exactly this impacts your district. However, we know that Pitt says there are 1,052 homeless veterans in Orange and San Diego counties, but the census identified 6,622 below poverty disabled veterans. This ratio tells us that the actual number of homeless veterans is probably much higher than what is projected by the Pitt count. I'd be happy to build additional profiles if anybody is interested. Clearly, Pitt counts are insufficient for capturing a complete picture of the need, and basing resource allocations on Pitt counts alone is highly detrimental to rural and urban service providers alike. But even with better data, and therefore more equitable distributions, we still will not be able to meet the need of the currently available resources. The current rate for the grant per diem program is grossly insufficient. For instance, we do not operate GPD in Carson City because it is not sustainable. To address this, I believe Congress should enact the Elizabeth Dole Home Care Act and implement and fully fund a new formula for GPD over the long term. Congress and the VA should also allow for SSVF providers to receive administrative costs at the same rate as other VA programs. And finally, Congress must recognize that reaching veterans in rural communities requires unique resources. In our case, we developed our telehealth-equipped mobile service units so that we can meet veterans where they are instead of waiting on them to come to us. Congress and the VA should provide rural partners additional funding to ensure we can reach every veteran, regardless of where they are. As I conclude my testimony, I want to recognize the fantastic work that this committee and the VA has done to improve the lives of all veterans. We've made great strides in recent years, but until we connect every veteran to the services they have earned, we are not done. Thank you again for the opportunity to be here today, and I look forward to answering your questions.
Thank you, Mr. Wood. Mr. Wood's written statement will be entered into the record. I now recognize Ranking Member Levin for 5 minutes.
Thank you, Mr. Chairman, and I was going to start with Ms. Haggerty. I'll come back to you because I have to thank Mr. Wood for those numbers. They are striking, and they're consistent with roughly what we've seen on our team. One line from your testimony that particularly struck me was the difference between what your data is showing in terms of the number of homeless veterans you serve versus what we see in the point-in-time count. Have another prop, 300,000 veterans each year accessing these services. We've talked a lot today about the true need in the community in terms of the prevalence of homelessness or keeping people out of homelessness. But can you speak to the true needs of providers in terms of serving veterans and what resources you need? And you spoke a bit about GPD, but if you could elaborate on that and what else you need to do the job.
Thank you for the question. If I can answer your first question, when it comes to the GPD program, we are not receiving the resources that we need. I have conversations monthly, as I talked about with the Carson City site. They desperately want to start a GPD program and reach people that we otherwise would not be able to reach. But we can't do it because it's not a sustainable model at the moment. So I look forward to a time where we can do that and start providing that service to those veterans.
What would you need?
Truthfully, we would need an increase in the bed night rate, sir. Currently, it's sitting at around $69 per bed night, and we're not able to provide all the services that we need at that rate.
The number that I've heard locally is around $100 would do it. Is that accurate?
That would fall in line with what I would think, yes, sir.
Appreciate that very much. Let me turn to Ms. Haggerty. Can't forget about you. Really have appreciated working with Community Solutions in my district in San Diego, Oceanside, in the area in North County, just helping all of us understand, again, the data around the drivers of homelessness, the efficacy of different sorts of solutions. One thing that struck me in your testimony was something I talked about before, was the importance of by name level data and identifying veterans who are experiencing homelessness to target individualized interventions and resources to end their homelessness. I concur with what Dr. Withrow was saying. You know, and really my experience is every veteran is unique. Everybody has their own story, the underlying factors. And I appreciated the testimony earlier of Dr. O'Toole. In the end of the year, you know, at the end there, we got him to say that. How close do you think VA is to having a national by name list of every veteran experiencing homelessness, and how can we help VA get all the way there, other than forcing an answer at a hearing?
And we so appreciate the opportunity to work with you in the city of San Diego and the team
And
there.
I think your mic may need to be turned on.
Thank you. And we are so appreciative of the chance to work with you in the city of San Diego and your team there. With respect to where Holmes is and the VA's ability to have a nationwide by-name list of veterans, we understand that they're on track. Certainly, I think the target date was the end of 2025, and so what Dr. O'Toole shared was consistent with everything that we have been seeing and hearing. And I think Holmes is definitely a robust system and will be able to do the job. And I think this focus on the consolidation with HUD and also the interoperability of data with other systems is going to be critical to get at what the chairman's point was about upstream systems. The more interoperable the data is from Holmes to the HMIS system, and also other public systems of data that are flagging people in crisis, that would be I think the promise here. But we are hopeful that everything we've been hearing from the VA is very consistent with they're reaching the goal of the end of 2025.
Thank you for that. How do VA's data capabilities compare with those of HUD?
We find that the home system is really solid, and one of the things that we work with in the communities that are part of Built for Zero is helping them to better optimize the HMIS system that HUD mandates. It has more capabilities than many communities are using, but I think the overarching concern that, as I mentioned in my testimony, is really creating the expectation and the standard of practice in HMIS that we have communities using by name data.
Watch out, he's tough with that gavel, so we're going to have to
By
leave
name
it there.
data and real-time data. It's those features more than the system itself.
Thank you. Appreciate it. Kneel back.
The gentleman yields. The chair now recognizes Mr. Crane from the great state of Arizona.
Thank you, Mr. Chairman. Thank you guys for coming. I realize this is a committee hearing about veteran homelessness and what we can do to prevent that. We talk about policy, we talk about technology, funding, housing, investment, healthcare, data, all these different things. I think all these things are great. I'm going to be honest with you, though. One thing, I think in many ways, one of our biggest problems is we don't actually get to the root cause. And that's why I was disappointed when I asked the panel before you guys, do you guys have any studies that you've done to actually look into the causes of this, especially when we're talking about numbers like $3.2 billion that this Congress, through the American people's hard-earned tax dollars, are going to be devoted to this cause. I want to read you guys a verse real quick. It's Matthew 11:28 through 30. It says, "Then Jesus said, 'Come to me, all of you who are weary and carry heavy burdens, and I will give you rest. Take my yoke upon you. Let me teach you, because I am humble and gentle at heart, and you will find rest for your souls.'" The reason I read that to you guys is because when I got out of the military, I'd done five deployments. 3 of them were combat deployments with the SEAL teams. And yet I realized many had done way more than I did. Many have given up way more than I did. But I was like this verse. I was tired and I was weary and I was pissed off. And I had survivor's guilt. And I was angry at the world. And the best thing that I ever did was I went to a Christian men's retreat that I didn't want to go to. And I'm not saying that's the answer for everybody, I'm not. But I would love to see us do a better job of actually addressing some of the issues that I believe can only be dealt with when we actually look at people's heart and some foundational stuff like faith. Why don't we talk about that when we talk about veterans homelessness? Because why don't we talk about that when we talk about some of the causes that lead to veterans homelessness, like addiction? I believe what Dr. Randy Withrow, sir, you said something on the panel today. You said it's not always about not having a house. Didn't you say that, sir? I agree with that statement. I really do. And just because it worked for me doesn't mean it's going to work for everybody else. But when we're talking about a sum like $3.2 billion, I'm worried that sometimes we just throw money at things without attacking the real problem and getting at the root cause. And I'll tell you this right now, if it worked for me, it'll work for some other veterans out there. And so I just wanted to say that today because I do care about my brothers and sisters, regardless of what service they were a part of, regardless when they served, what their job was. But I know from experience that for a lot of them, they're weary, they're heavy burden, they're pissed off. They saw things that most human beings should never see or do. And sometimes giving them a house isn't going to fix what the root cause is. And so I just wanted to say that today. Thank you, Mr. Chairman. I yield back.
Mr. Crane, the gentleman yields back. Mr. Crane, I want to thank you for that, and I would like to associate myself with your comments. We had hoped that we would have Hope Ministries here also. But unfortunately, I was not able to travel here. I used to work with something called the Mighty Oaks Warrior Foundation, and they address the root issues. The true upstream cause of many of these issues is the wounds that we have on our souls.
Mr. Chairman, I looked up, I did a quick search on it. I found easily 20 or 30 in faith-based ministries for veterans, and they're not all my faith. They're across the board, but I think that's something that we should maybe look at in the future, doing a hearing on something like that, Mr. Chairman. Thank you.
Mr. Crane, there is something called the Sergeant Fox Grant Program, and I asked specifically one of our people from the VA what percentage of the monies are going to faith-based programs, and I believe he said 19%, and we looked that up, and that's just not true. Is that right, Chase? So part of the issue that we're having here is that the VA is not being honest, and they're intentionally excluding some of these faith-based programs that have proven to be some of the most effective. I think 2 or 3 people that have gone through the Mighty Oaks Warrior Foundation have committed suicide out of the 8,700 people or so that have gone. That is an amazing record. And am I trying to say that people need to go to a Christian program? I am not. Am I saying they should go to a program that's based on the Islamic faith? I am not. Or on Mormonism or any, I'm not saying that, and I concur with you, Mr. Crane. It's very heartwarming to hear you say that. Because if we're not taking all options, then why are we taking any? We're sticking with these treatment modalities that have proven to be not effective. So let's do something different. Thank you for that, Mr. Crane. I now recognize myself for 5 minutes. Ms. Haggerty, what's your budget?
$24 million.
How much of that is government money?
None.
0. Okay, so that would make 100% private. Mr. Carville, what's your budget?
25 million,
25? How much of that is government?
roughly 70% from the federal government.
70%. Okay, Mr. Withrow?
We roughly get from the WDVA right at about $8 million.
So your total budget is 8 million?
Right.
And it's 100% government?
Yeah.
Okay. Mr. Wood, what's your budget?
To be honest with you, sir, I am not sure.
Okay.
I know that a vast majority of it is government money.
Okay. So, Ms. Haggerty, would you consider your organization to be effective?
Very, sir.
Okay. Mr. Carville?
Extremely.
Mr. Withrow?
Mostly,
Excuse me, Doctor, I apologize, Dr. Withrow.
mostly.
Very well. Mr. Wood?
Yes, sir.
Okay, so I think just by this little mini cross-section here, from 0 to 100% government funding, we can say that the effectiveness and the efficacy of these programs are not based on government funding, right? I mean, because they're not. If you're effective and we have every little, we go from nothing to everything spectrum here. So I think that we need to look oftentimes externally to the government. I don't think that the government is the solution to these problems. I believe that we can be very effective in helping move the ball down the field, and again, that is functional zero. But I also think that we need to utilize some of these other groups and allow them to serve their people, their constituents. And that's why, talking about what Mr. Crane was saying, if we are not engaging these groups across the board, and we do have on our previous panel a gentleman that's responsible for interagency coordination, if we're not honestly and openly looking at all of the available options, then we're not doing service to the veterans. And when the Veterans Administration serves the Veterans Administration and not the veterans, they are out of sync with this committee, and they're out of sync with the vast majority of the members of Congress on both sides. I don't know a single, Mike, do you know a single member of Congress if you go from the far left to the far right, that doesn't want our veterans to succeed?
Sure as hell hope not.
Okay. So if we're all thinking this collectively in a nonpartisan way, and you guys are thinking about this in a nonpartisan way, but we have a government agency that appears to not be approaching this problem set for whatever reason in a nonpartisan way, that's a problem. And if they're failing to look at all of the available options, they're not doing their jobs for the veterans. And if the Veterans Administration is not doing the job for the veterans, that means by default they're doing the job for themselves, and that's unacceptable. And it is completely out of line. So I would like to see some more honest reporting. I want to talk to that guy again, by the way, that gave me that 19% of the Staff Sergeant Fox budget's going to faith-based programs. I'd like to see him sitting here again. And I also want to get down with Mr. Crane again and have if we can do a faith-based program panel. Because you look at the level of recidivism, you look at the level, sir, of people going back and falling back into drug and alcohol addiction and spousal abuse and all that stuff, when you actually do the upstream solution that Mr. Crane was referring to, it plummets because you're addressing the soul, not the physical condition. I guess I don't really have any questions other than ones I ask you about your budget, but I really want to thank you guys and gal, for coming today. And on the first panel, I see you back there. I appreciate you showing up. We have more work to do. It's very simple. Until we have every community join the 84 that have reached functional zero, our work will not be done. And I do appreciate the term functional zero. Actually, my ranking member told me that term. And it is true. We are always going to have folks that are going to be on the streets, unfortunately. But when we can get to functional zero, it is an incredible accomplishment. With that, I'd like to recognize Ranking Member Levin for any concluding remarks he may have.
I just thank the chairman for the hearing today and for just our shared purpose and commitment to ending veteran homelessness. It's a daunting, difficult, complex issue, and I'm very grateful to all of you for the work that you do each and every day. As service providers, as community leaders, everybody has a different approach. Every region is different. Every area is different. But I do think it is worth the time and trouble to understand as best we can how these 84 communities got there. And I'm sure different communities got there different ways. And it's not a one-size-fits-all. But I do think it's worth understanding best practices. And I'm very grateful for all 6,800 people, Doctor, at VA as well, and the work that they do. It's difficult work. But it's extraordinarily rewarding. If anything like the work that we do on the committee here, where we actually see the positive benefit of the work that, hopefully makes a difference in people's lives, then I think it'll all have been worth it. So thank you, Chairman, and I'll yield back.
Thank you, Ranking Member Levin. Thank you all again for coming today. I ask unanimous consent that all members may have 5 legislative days to revise and extend their remarks and include extraneous materials. Without objection, so ordered. This hearing is adjourned.